Hello, my name is Nicole Gilmore, and today I'll be talking about systemic lupus erythematosus. This disease also goes by SLE. SLE is an autoimmune disease. With this disease, the immune system of the body inaccurately attacks our healthy cells. Our immune system is a large complex of organs, white blood cells, proteins, and chemicals. They all work together to protect our bodies from foreign pathogens. Lupus is a chronic autoimmune disease. It affects multiple body systems, and as I said before, it's our body's own immune system attacking healthy cells within our body. Signs and symptoms with lupus are fatigue or extreme exhaustion, regardless of how much sleep the person has had, muscle and joint pain, swelling, skin rash. People with lupus tend to get a butterfly-shaped rash across their face, fevers, hair loss, recurring mouth sores. Other symptoms are sensitivity to the sun, lung problems. People with lupus tend to have sharp pains, chest pains when they breathe deep, fingers and toes turn blue or white, or they feel numb, heart problems, kidney problems. They could deal with psychosis, anemia, clotting problems, eye disease, and memory loss. Some of the causes that have been linked to lupus are hormones, genetics, and environment. When we talk hormones, hormones are our body's messenger. Hormones regulate our body functions. Men and women both produce estrogen. However, women produce estrogen at a higher rate than men. When women produce these higher levels of estrogen are around the time they're about to start their menstrual period, during their menstrual period, or at the time of pregnancy. And this is the time when women start to have signs and symptoms from lupus. When we talk genetics, people who develop lupus do not have a family member that have lupus, and it's really not found in their family history. They have not been able to link one gene or a group of genes to lupus. When we talk environment, environmental triggers are not well known yet. However, UV ray sunlight can trigger an outbreak. Infections and emotional stress can also trigger lupus to occur. Pathophysiology of lupus has to do with our immune response and hyperactive cells. Autoimmunity is a system of immune response of an organism against its own healthy tissues. People with lupus have B cells and T cells that become hyperactive. This will cause production of anti-nuclear antibodies. These are antibodies that recognize and destroy our healthy tissue. Almost 100% of people with lupus have these anti-nuclear antibodies. Lupus is a chronic condition where there are intervals of activity and remission. Systemic lupus is distinguished by inflammation that starts at a molecular and cellular level. Organs affected by systemic lupus are pretty much all of them. Systemic means the entire body. The brain can be affected, the eyes can be affected, the skin, the heart, the lungs, the renal system, the gastrointestinal system, the reproductive system, the blood, and the musculoskeletal system. Signs and symptoms vary from person to person. These signs and symptoms are determined by which body system is being compromised. Regarding the brain, cognitive dysfunction, unable to think, clear, diminished memory, a decline in oxygen transport to definite parts of the brain. Headaches, also to do with the brain. Almost 20% of people with lupus experience headaches that mimic migraines. These kinds of headaches are diagnosed by a spinal tap and have to be treated with corticosteroids. Our eyes. People with lupus experience dry eyes caused by inflammation in the lacrimal gland. The inflammation stops the natural lubrication that our eyes make. Within the skin, one indicator is the butterfly rash across the nose, the cheek, and the cheeks. Another indication is the rash and sensitive to the sun. People with lupus will have flaky red spots or scaly purple rashes due to sun exposure. The heart, chest pains, irregular heartbeats, inflammation around the heart sacs, the heart walls, and the heart muscles. Regarding the lungs, it's caused by inflammation again. So we have inflammation membrane lining of the lungs. Blood vessels within the lungs. The main symptom is the lining that covers the outside of the lungs becomes swollen. Individuals experience sharp stabbing pains, and it gets worse with deep breaths, coughing, sneezing, laughter. Shortness of breath is also a symptom. Kidneys. Kidneys are inflamed as well. This could lead to foamy urine because of increased protein, brownish urine because blood is present, swelling in the feet and the lower legs. Gastrointestinal system, the digestive system. This includes the digestive tract, the mouth, the esophagus, the stomach, the intestines, the anus, the liver, the pancreas, and the gallbladder. One cause of digestive problems could be a side effect of lupus. However, others might be medication related. Within the mouth, lupus can cause open sores within the mouth, and the gums also become inflamed. Within the esophagus, the inflammation could cause the muscles we use to swallow to become weak. This in turn could cause acid reflux that could last for a long time. This may turn into gastroesophageal reflux disease, also known as GERD. Symptoms from GERD are gas, heartburn, chronic cough, and vomiting. Within the stomach, the person could develop open sores in their stomach lining, also known as peptic ulcers. This is a side effect of the medication. The side effects of this medication are stomach pains, nausea, vomiting, dark bowel movements, which would say that there was some blood in the stool. The intestines. Lupus rarely will cause inflammation within the intestines. In the intestines, symptoms are abdominal pain, being bloated, diarrhea, vomiting, and a loss of appetite. Some people with lupus develop irritable bowel syndrome, also known as IBS. Symptoms of IBS are abdominal pain, gas, diarrhea, and trouble having a bowel movement. The pancreas. Lupus can cause the pancreas to become inflamed. The symptoms of pancreatitis are stomach pains that might move to the back, nausea, vomiting, and fever. Then the liver. Lupus or medications from lupus can cause hepatitis or cause the liver to become inflamed. Known symptoms are fever, tired, jaundice, yellow skin and eyes, nausea, and vomiting. Reproductive. Lupus does not cause infertility problems. However, it can make it very difficult for a person to get pregnant. And if they do get pregnant and they have lupus, they will be considered a high-risk pregnancy. It's safe to get pregnant, but it's better to wait 6 months of inactive lupus. So basically wait until your lupus is in remission to decide to get pregnant. Lupus can cause preeclampsia. Preeclampsia starts with high blood pressure and can affect the liver and the kidneys. And since we have so many other problems already because of lupus, we wouldn't want to have preeclampsia. Signs of preeclampsia are blurred vision, stomach pain, headaches, dizziness, swelling of the face and hands. Lupus medication can affect a person's ability to get pregnant, or chances of miscarriage are become very high. Within the blood. Blood cells most affected by lupus are our red blood cells and our white blood cells and our platelets. The chief problem with blood when having lupus is anemia, low hemoglobin of the red blood cells, or thrombosis. They develop and produce a lot of blood clots. Musculoskeletal. It's common for a person with lupus to experience muscle aches and pains, or other muscle groups can be inflamed. 90% will experience this. They will have muscle aches and pains during a lupus flare. These muscle pains are caused from the body replying to inflammation. Lupus arthritis. The person will have pain, stiffness, swelling, tenderness, and joints will be warm. The affected joints will be the extremities, the fingers, the wrists, the elbows, the knees, the ankles, and the toes. People with lupus will be stiff when waking up, which gets better during the day. However, they might have pain later on in the day. Joint pain can be felt on both sides at the same time. Lupus arthritis. Lupus arthritis is compared to rheumatoid arthritis. However, lupus arthritis will not destroy joints in all patients. There has only been 10% of the lupus population that have developed deformities from lupus. Diagnosing systemic lupus. There's not one single test to diagnose for SLE. However, one of the blood tests that will be done is a CBC. That's a complete blood count. What a complete blood count does is it measures the number of red blood cells, white blood cells, platelets, the amount of hemoglobin, which is a protein in the red blood cells. If it shows that a person has anemia, that could be a sign that there may be lupus present. Also, if they have a low white blood count and the platelet count is low, this will also show that there may be lupus present. They'll also do a blood test to check the kidney and liver functions. If the kidney and liver functions are low, that is another indicator that there may be lupus present. They'll also ask for a urine sample. When they take the urine sample, what they'll do is they'll check the urine sample to see if there's an increased protein levels or red blood cells in the urine, which may be an infection because of lupus. Another test that they'll do is an anti-nuclear antibody test. A positive test for this presence of these antibodies produced by your immune system indicates a hyperimmune system. When it comes to the x-rays, they'll do a chest x-ray. And if the chest x-ray of the lungs show that there's cloudy lungs, it could be fluid or inflammation. That's another sign that there may be lupus present. They'll also do an echocardiogram. This test uses sound waves to see the hearts beating in real time, to see if there's any irregular heartbeats. Lupus is extremely hard to diagnose, and it's often misdiagnosed. And one of the diseases is misdiagnosed for is fibromyalgia. With fibromyalgia, they also develop and suffer from skeletal, muscular, and joint pain. So that's why it's often misdiagnosed for this. There are several ways to manage lupus: doctor visits, reducing stress, food choices, and last but not least, medications. A person that has lupus should visit their doctor regularly. This way, the doctor could draw labs up and manage their organ functions. They should also reduce stress. A person that has lupus, if they're under a lot of stress, this could cause a lupus flare-up. They should also set realistic goals. Food choices. Food choices for a person that has lupus are fatty fish like sardines, salmon, and oysters. Also, red meat. A person with lupus should also drink a lot of water. They should stay away from sodas. Medications like hydrocortisone and corticosteroid also help to manage lupus. Also, they should limit their time in the sun to promote good skin integrity. A person should learn and be able to tell when a flare-up is about to occur. This will also help them with managing their lupus. Exercise is also suggested for people with lupus, but they should talk with their doctor first. Prognosis in regards to lupus. If managed properly, people with lupus can go on to live a happy life. Survival rate. More than 60 years ago, the survival rate with lupus was 5 to 10 years after diagnosis, and that was at 50%. Now the survival rate is at a 90%. The highest mortality rate for lupus are among those older women that are African American and Hispanic. Higher survival rates are found among people with lupus that live in eastern and northern parts of the United States, even with people who fall into the higher mortality groups. The most common cause of death among people with lupus is cardiovascular. Cardiovascular disease is going to be the most common reason people die from lupus. And then that will be led up with infection. The epidemiology of lupus, gender disparities, age distribution, and racial tendencies. When we talk about gender, lupus is higher in women instead of men, affecting women 80 to 90%. We talk about age, cases are broad, starting from children at 2 years old to 80-year-old adults and older. Females are usually diagnosed with lupus between the ages of 15 and 44 years of age. Race. Lupus is more frequently affecting African Americans, Hispanics, and Asians. Caucasian women are less likely to suffer from lupus. When we talk about the history of lupus, we'll go from 1948 to present. Lupus erythematosus, the LE cell, was discovered by Hargraves in 1948. He observed the cell in bone marrow, and that's where he first coined it. First animal testing was with a mouse. That's where they tested the role of the sex hormone, and they found out about estrogen. Genetic acknowledgement in 1954 recognized coordinates of lupus in myozygote twin pairs. However, the classic period was from 1230 to 1856. Current research development regarding lupus. Clinical management. They're starting to use a non-steroidal anti-inflammatory drug. This drug will decrease hypertension, infection, and decrease the death rate in patients with lupus. This is a broad spectrum immunosuppressant that will help the lupus patients. Modern science findings. Their finding involve multiple genes with threshold effects. Future advanced research. They're stating over the next 25 years they'll be making way more headway with understanding and identifying genes with lupus. They want to understand why lupus affects African Americans, Hispanics, and the Asian community. Environmental triggers genetics profiles with new genetic technology. Famous people that have been diagnosed with lupus. Lady Gaga, she's an actress, a singer, and a songwriter. Toni Braxton, who is a songwriter and singer. Selena Gomez, who is an actress, a singer, and a songwriter. And Nick Cannon, who is a rapper and an actor. Lady Gaga tested positive for lupus in 2010, but she had never had any signs and symptoms. She was concerned because she had an aunt that passed away from lupus and wanted to get tested. Toni Braxton, diagnosed with lupus in 2008 and was told she would need a heart transplant and she would never be able to perform again. However, she is still performing. Selena Gomez, diagnosed with lupus in 2015. She had to have a kidney transplant at the age of 28 years old. Nick Cannon. Nick Cannon was diagnosed with kidney lupus. So he wasn't diagnosed with systemic lupus. He had lupus in his kidneys. He decided to do a whole life change. He changed the way he ate and he changed his workout regimen. He decided to start eating fatty fish like salmon, and he also stayed away from processed foods because they were high in sodium. SLE is an autoimmune disease that will attack all organs. During my research, it would appear to me that these hyperactive cells are beating up tissues within the body because all of the damage is done due to the main organs is inflammation. 14.5% of people with lupus can have complete remission for 3 years, but that will be after they've dealt with it for 10. I hope you enjoyed the video. Thank you.